So good morning, good afternoon, and good evening. Welcome to the 1536th day of continuous and uninterrupted Zoom session of IFPS. Today we have with us Professor Dr. BAINU SHARMA MD, Department of Material Medica, JIMS Homoeopathy Medical College Hospital, Hyderabad, more than 22 years of clinical experience. The topic is Art and Skills of Observation Homeopathy Practice, Part 3. On behalf of IFPS, I welcome you, sir. You can have a platform for next 45 minutes. Please proceed, sir.
Good evening, everybody. This is Dr. BAINU Sharma. I hope my slide is visible, sir. Is it visible?
Yes, of course. No problem.
Okay. So let us start the third session in continuation to the art and skill of observation in the utility of homeopathic practice. As a quick review from the past, in the first session, we learned about the art and skill of observation. We learned about how do we make observations. We learned about what observation is. Then we shared 4 cases. Then in the second presentation, we learned about chronic case-taking observations, how we miss small observations and how observations can help us to prescribe remedies which are rare, which can be constitutional drugs for such kind of constitutions. So now let us take ahead the presentation. We are talking about observations since last 2 presentations. So now how do we get observant? How should we sharpen our skills of observation? Initially, in the first slide, we discussed that for human beings, the most important tool for observation is our 5 senses. So yes, first of all, when you need to be a keen observer, your eyesight, your sense of sight should be very, very sharp. Use your sight to be keen observers. Your curiosity should never be low. Every time you have to be very, very curious. You have to be very, very inquisitive about your surroundings, about things happening in your surroundings. And every time we are into a new learning, we should adopt the mindset of a beginner. We should approach everybody without any preconceived notion. As the master has also mentioned in the Organon of Medicine, that we should be unprejudiced observer. We should act like a child with all the sense of wonders and discoveries, but we should not be childish. But that curiosity, that inquisitiveness, that hunger to learn should be like a child. Always ask to yourself, what do I choose to see? Where do I direct my attention? Because eyes will not see what mind cannot perceive. You will look at things which you only want to look at. So please ask to yourself what you really want to look at. That is very, very important. Learn to switch your focus by zooming in, zooming out. Don't just stare at one thing for a long time. Pay attention in your peripheral vision also, because so many things will be happening in and around your surroundings. And whenever you are in a setup where you are into a question-answer session, please do not hesitate to ask more and more questions. Do not hesitate or do not be timid in asking about your doubts. Because if you will stop that, if you will stop your curiosity, means you're not quite observant about your surroundings. You've not observed that phenomenon happening around you. Cross-check with your friends about whatever you've missed. Check it again. And switch your positions. Maybe you will learn something new from somebody else's perspective. Maybe you'll get different vantage from different points, different perspectives. So these are the 10 points which can help you to be a sharp observer, a keen observer. All these things everybody is aware of. The only thing is that at times we tend to ignore all these things. So I'm just reminding you all that you have to be a very, very keen observer. Not only to be a homeopathic physician, but to be a physician, because our duty is to serve humanity, and we cannot do that with a reluctant or ignorant behavior and ignorant attitude. So there are different types and different methodology, how we utilize those types and methodology in the practice of medicine. Like when we are taking cases, all these technologies, all these medical technologies and diagnostic machines, they help us in recording the data, all the instruments. So you can even record your data with the help of all these instruments. Basically, I'll tell you in a very summarized way about the types of observation, because I don't know how many of you will be listening from a researcher point of view. So types of observation, basically we have participant and non-participant type of observation. So in participant observation, as the name suggests, the researcher or the participant who is doing the research, he himself becomes part of that activity or part of that research about which he is studying. For example, suppose you want to learn about the culture of a tribe, a specific tribe. So if it is a participant observation, you will go there in that locality, in that community, you will stay with them, you will do whatever they are doing, you will adapt their lifestyle, their food, their eating habits, their clothings, everything. Then you are writing and noting down their observations. That is a participant observation. In non-participant, you will be observing the whole phenomenon as a third party. So you are an outsider. That is a non-participant observation. Second set is controlled and uncontrolled participation. So as the name suggests, in a controlled observation, all the parameters of your study or of your research, they are predefined. Already you have defined your parameters, like you've decided the location of the research. You have also decided the time of the research. You've decided the number of participants or people who are going to take part in that research. So that is how, and the tools which are going to use for that research, that also you have actually decided. So that is a control. In an uncontrolled observation, you can observe people, observe their lives in a natural way, in a natural setting, without any external influence or any pre-planning. That is a uncontrolled observation, which we do all the time in our surroundings. Then comes structured and unstructured observation. So in a structured observation, again, we have this list of a specific behavior which we give to the researcher, and we ask that this is a set of behavior that you have to observe in that study. So again, that is planned, three is pre-designed, the whole study material is pre-designed. And in unstructured, you don't have anything, you just keep on observing the way things go in your surroundings and you keep on making a note of that. I'm teaching in a medical college. We take our undergraduate students for their clinical exposure. We are taking first year students to the OPD for their clinical classes, where we just ask them to stand and observe. So as per the new curriculum, the students of first year in their second term are supposed to observe, nothing else. So they just stand. They have this structured format in which we have told them what all to write. Priorly, we informed them. And then they observe like a non-participant, but with a structured format where they will write down. And in a controlled environment of this hospital, everything is decided. This is a hospital. These are the tools which we will use for examination of a patient. This is the place where we'll sit. This is the patient. This is the physician. So basically, it is a non-participant structured and controlled observation, which our UG students are doing in their clinical classes. That was just to give you the example. So this is a broad narration of types of observation. Then what are the steps? How do we start? As in the first, I think in the first session, I explained that Dr. Hahnemann has also mentioned it in his organon of philosophy, that the first step towards a case taking in homeopathy or any pathy is observation. So we observe the patient, then whatever observations we are making, we will document that. Whatever we are doing, we are documenting, we are verifying that. We have to verify that. Then we take a detailed interview of the patient. That also we are making a documentation of. So that is how this methodology goes on in the case taking. Why do we do all this? Why are we doing all this? What is the basic idea or fundamental behind this? So that we can develop a baseline information between the physician and the patient. We need to gather a basic information, which we start from taking the preliminary data of a patient. Then after taking this detailed family history, past medical history, his physical generals, we determine his normal functioning. We understand how this body normally works of that sick who is visiting our clinic. Then after taking his past medical history, after taking his family history, we also determine his risks for dysfunctioning. So we are trying to understand that individual at that time when we are taking a case from 360 degrees altogether. We try to understand his strengths. We try to understand his weaknesses. We are understanding how he works when he's normal. We try to understand his risk dysfunctioning. So we are developing a portrait of this patient through observation, through documentation. Then we verify that. We verify with the help of investigations. We verify it with the help of attendants, family members, whoever is, present at that time when we are taking the case. And then we gather enough of data to diagnose the person. So these are the basic reasons why we are doing the whole phenomenon of case taking. And how do we collect the data? Everybody is aware of that. We have basically two factors. One factor is the subjective data and the other is the objective data. Subjective data is something which the physician feels, but he's not able, which we can't see. That is a covert data, which can be just felt by the patient, like headaches or like pains or like weakness, right? The objective data is the signs which we can see. The signs like discoloration of the skin or measuring the blood pressure. These are the objective data, right? Then what are the methods? Interview method, as I told you, we take the interview of the patient, whether it is the directive or indirective. Directive interview is when you are interviewing the patient directly. Indirective, when you're calling the attendants or when you're depending on the investigations, that is the secondary or indirective data collection. Then we observe the patient, we observe the changes in the skin, we are observing so many things which he is suffering from since the day he has started developing that disease. Then we examine the patient, all the 4 steps of examination: inspection, auscultation, palpation, percussion. And last, but which holds an importance, is the intuition of the physician. Use of insight, use of instincts, clinical experience, to make some kind of clinical judgment about that particular patient who is sitting with you. Then the sources, as I told you, sources have to be 2. One is the primary source, that is the patient himself. He will tell you all the details of his symptomatology. And the secondary source. The secondary source, that is the indirect source, mainly that is the patient's reports, the patient's family members, his health professionals, and the diagnostic results. That is the secondary source of data collection of a patient. Then we validate the data, the process of confirming. Then we organize the data, we cluster the whole information which we have gathered, and then we document the data. All this information is known to all of us, but there is this typical protocol of validation, then organization and documenting, which is very, very important. Most of us are having a flourishing practice. We have so many patients coming to our clinics that we don't get time to validate or to organize or to document the data in a proper way. So that is very, very important. If we will document the data, we will collect enough of literature to prove how the pathy is working, to prove to the outer world how homeopathy works. So, and we are lacking behind that. So I feel we should have more and more of cases nicely documented, which we are seeing. All of us are having wonderful, miraculous cures in our OPDs daily. It's not that we don't have that, but we don't document that. So that is very, very important for us now. We really need to prove ourselves. Even though homeopathy is the second most popular pathy in the world, first being allopathy, but still homeopathy should be the limelight of the branch of medicine. Then today I didn't prepare a case to present, because every time I present a case, the time exceeds. And I thought today is a day where we should conclude this prolonged session of 100 slides. So I just thought that because the topic is the observation, so what are the common observations in our clinical setups? Which are the common things which we in our day-to-day practices we are observing, especially in pediatrics? So one commonest observation which we come across in our clinical setup is shyness, timidity. Many children will come to our OPDs who are shy, who are hesitant. Very few kids come to our clinics or OPDs where we'll see they're, very outspoken and very straightforward and very friendly and affectionate. They'll directly come to you and talk to you. And in fact, not only that, they will develop a rapport between you and everybody around very fast. So most of the kids, they come with a very shy behavior and attitude and very timid. So basically, what is this timidity? A feeling of fear or discomfort, which is caused by other people. He will come to a new setup where he'll be, coming across few new faces, few strange people, especially a new surrounding. So he becomes fearful. Out of that fearful, he becomes shy and he becomes timid. The child might cling to the parent when he's shy. These are a few expressions of timidity which we come across daily. One, he can cling to the parent. But the parent should know that the shyness is the personality of a child. It is nothing pathological or behavioral disorder. The child might be hesitant to make new friends or hesitant to talk to new people in a new surrounding. The child might hide behind the parent. He might hide behind the blanket, or he might be reluctant to talk to people. These are a few expressions of timid children. And this last Saturday, we had a case of this girl. I will just show you the video to just so that you really understand what timidity is. So if the audio is not very, very audible, ignore that. Just observe this child, this girl child. See, Didi wants to give you chocolate. This child came to the hospital OPD for upper respiratory tract infection. And the mother told us that she's fond of chocolates. So one of these, this is the mother, and she's carrying her younger brother. Look at the child. The child is not ready to make eye contact, even when her favorite chocolate is being given to her. You want mama to sit on the floor? Mama ko chair mein bolo, baithne ko. Chair pe sit, beta. बिल्कुल बिल्कुल नहीं देख रही है भाई. ज्यादा बात करते हैं. स्कूल जाती है. हाँ, स्कूल जाती है. इसको अक्सर कोल्ड हो जाता है. हाँ, इसलिए नहीं होता है. Just observe the child. Everybody, my PGs, my UG students, all were trying to interact with her, but she did not look up even for a single second. She was just looking down. So only with the ghar ka people she's okay, but when she goes out, she becomes extremely timid. And on asking the mother, she told that after the birth of a younger brother, she became more timid and more shy. Many a times, if we keenly observe these kids, and if we repetize, and if we pick the right rubric, we end up restoring the patient. We had a 10 minutes ka video of this girl, but in that 10 minutes, she didn't look up at all. She's not looking up. So, what did you make out from this? Did you see in this? This is, I think, a 3 minutes video. This was, and in that 3 minutes, not even for a fraction of a second, this child looked up. She was totally looking down. Why do we come across this kind of shyness in children? What is the reason? What is the cause behind these kids to be shy? Genetics. Some children are born with a temperament. They tend to be shy. Very important reason. Personality. Some children are more sensitive. They easily get intimidated by people. They easily get intimidated by new situations, new environments. Third, learned behavior. Children learn from their parents. Shy parents may teach their children to be shy. That can be a factor. Family relationships. Children, who don't feel secure with their parents. Maybe they adapt this as their defense mechanism, being shy, being timid. They don't feel confident enough to talk because of this discord or tussle between the parents. They don't feel secure with the parents. Children who are, not around with so many people in their early years of life, they may not have that good social skills to interact with the strangers or to interact with the unfamiliar people. So the genetics, the personality, the learned behavior, the family relationships, this lack of social interaction, these are causes which make you shy, which make you timid. Harsh criticism, children who are teased, who are bullied in the schools by people, by dominating people. So they tend to be shy. Fear of failure. Children who are pushed too hard and, they are made to feel bad when they don't succeed. They again are afraid to fail every time. They may act shy. That hesitation that, my parents wanted me to score good marks, but I could not. So then I become hesitant. And then I think 1,000 times before facing any situation. So I become shy and timid. Any major life event like parents' divorce or, any death in the family or moving to a new school or new environment, then the child becomes more cautious. So in such kind of social situations, the child may tend to be more shy. So these are the basic important causes towards timidity or towards making a child more shy. I have made things very easy for you. I have collected a few drugs which are very, very important for timidity in children. So the first grade drugs, everybody will be knowing that. When we think of timidity, when we think of shyness, the drugs which comes first and foremost in our minds, of course it is Baraitaka, of course it is Pulsatilla and Silesia. Then second grade drugs also, let us see. Bryonia, Calcarea carb, Gelsemium, Kali carb, Natrum carb, Lycopodium, phosphorus.